greatest medical discoveries.
We're back from Disney. This is a weekly, so.
Oh, hey guys. I thought it was a Patreon.
We just did Patreon.
Yeah. Okay, so this is our weekly.
We're back from Disney. If you
We
guys
are.
follow us on social media, you saw all of the bombardment that there's my dog and his balls. For those of you that are not watching us on YouTube, if you're not watching us, then it's just Brownie spread eagle in the background. That's my background for
Loves
today.
it. All right.
So we just came back from Disney. I hope you guys loved all the content that we were putting out there. And thank you for
Yes.
asking all the questions and stuff like that. Keep a lookout on our socials because I'll keep doing that. But anyways, we're back today. And we're
This
going
was
to be...
another request by
Yeah. I think on
follower.
Threads as well.
Yeah.
Yeah.
We're
So
popping off on Threads.
I know everybody, whoever is listening or watching right now from Threads, we love you guys. Like you guys are phenomenal. And you're so nice too. Like you guys are so nice. Knock on wood. You guys are awesome. Anyway, so you guys wanted to know about what we thought were our greatest medical discoveries or whatnot. And look, this is not a comprehensive list by any stretch of the imagination because there's way too many things out there to cover.
Really great things. Yeah.
But this is going to be like the highlights.
Yeah.
Historical and recent. Big highlights of, that they really stand out in medical,
And we encourage
discoveries.
everyone to post
Please.
and comment what they think one of the greatest medical discoveries
If we don't
been.
mention it. And also, if we mention one that you want a full-length episode on, any of these topics, any of these discoveries that we talk about, you want to hear more about it, hey, let us know. And we'll dive deeper into it.
I just thought of 2 or 3, and already one of them is the first one that we're going to talk about.
Yeah, exactly. I mean, I had to put that one as the first
Yeah.
one. Also, this is in no particular order of importance or whatever. This is just, good ones that we thought of at least.
Yeah.
So, yeah, let's start with the first one, Doc.
Since I'm a pediatrician, what do you think I'm going to say, guys?
Yeah, it only suits you.
Vaccinations.
Yes.
Guys, vaccinations. Think about it. Back then, okay, when people were ridden with pox virus,
Oh,
Okay.
nasty stuff.
which we're going to talk about now.
Yeah.
When people were ridden with pox virus, some man was like, I'm going to kill this, and then I'm going to inoculate it into someone else to see if our body creates some protection. And he did it. And that was the birth of vaccination.
He fucked around and found out.
Yep.
That was like the definition of it.
Yeah. So vaccines are one of the greatest medical breakthroughs in history. The concept of vaccination was discovered by English physician Edward Jenner. Sorry.
We are suffering from that same cold that apparently the whole entire United States has.
Got way too excited there. Way too
And she's very pumped about vaccinations because it
well,
is her.
pumped about vaccinations because now we
your
have
bread and
measles outbreak.
It's fucking stupid.
So you know what? I'm gonna sell this shit.
It's
All right.
true. It's true. In this age, we shouldn't even have. We didn't.
I don't need to sell this. This
Yeah.
speaks for itself.
We didn't have measles, and I hope that if you're a listener to this podcast, you are not an anti-vaxxer because I mean we're
and
pro-vaccine
even if you are,
here.
you can keep listening and see if I can convince you.
Exactly. That too.
Well,
Education's key.
No, education is key. And I actually tell a lot of my parents that come into clinic, if they don't vaccinate, I was like, you are able to leave with no vaccines. However, you are not able to leave without a conversation about vaccines.
Good. That's awesome.
So that
That's
one
awesome.
day, maybe they'll turn around.
Yeah. That's the best
All
you
right.
could do.
So, vaccinations are one of the greatest medical breakthroughs in history. The concept of vaccination was discovered by English physician Edward Jenner in 1796. 1796.
Yeah.
So, he noticed that milkmaids who had caught cowpox did not catch smallpox and tested his hypothesis by inoculating a little boy with the material from cowpox sores. Okay. So the boy became immune to smallpox, and then this method was called vaccination from vaca, or the Latin word for cow. Okay?
VACCA.
Yeah. So the importance of the discovery is crazy monumental.
Yeah.
Vaccines have saved countless of lives. You know, they've actually eradicated a lot of things with vaccinations. Okay. So it's preventing deadly diseases like smallpox, polio, and measles, which unfortunately now with a lot of the wave of anti-vaxxers and just a lot of social things going around.
Yeah.
People are not vaccinating, and now we are starting to see these things come through. And it's not just measles. We are seeing polio like a lot more.
And that's scary. Polio is no
Yes.
joke, guys.
Yes.
Like, it's not a little cold and it'll go away. No.
Yeah. So they work by training the immune system to recognize and combat these pathogens, either viruses or bacteria. So by introducing a harmless part of the pathogen into the body, the immune system can respond more quickly and effectively when you actually do get exposed with the disease in the future. So the discovery of vaccines has led to the eradication of smallpox and has significantly reduced the prevalence of many other infectious diseases. It has transformed public health, allowing to control of epidemics and improving the quality of life globally. The year when first vaccine was introduced was 1796. So that was a major medical discovery. And I'm not talking about, like the new vaccines and COVID and, no. Relax, people. Take a step back, sit down, sit your ass down.
Put down the pitchfork.
Put down the pitchfork, okay?
Yeah.
Just really look. Sorry, guys, that was not my stomach. That was not.
That's Brownie for those of you that are not watching.
Yeah, that was
He's
him
literally right in
grunting.
between us now.
Yeah.
Yeah.
So, anyways, yeah. Do your research, guys. Vaccine saves lives.
Absolutely. And another podcast that does an excellent, like deep dive in vaccinations and just everything that has to do with vaccinations is Science Versus.
So good. So
Amazing, guys. Like, really, I have to call them out on it because I heard, and it's several parts. It's not a big, long thing. It's split really well, and it's broken down very easily to digest and understand. Honestly, give it a shot. Even if you're anti-vaccine or you're with vaccines like I am, listen to it because the hosts and everything about it,
everything about that show and that
wonderful,
and that segment on vaccinations is extremely well done. Yeah.
So good. So give it a shot. Knowledge is power. Even if at the end of it, you're still like, nah, I'm good. At least you learned something. I guarantee you'll learn something. But anyway, next one, anesthesia. Yes. The discovery of anesthesia is a pivotal moment in medical history, marking a significant shift in surgical practice and pain management. The use of substances to induce insensibility dates back to ancient civilizations, but the first public demonstration of modern anesthesia occurred in October 16th, 1846, known as Ether Year. Ether, right?
Ether Day. Yeah.
Ether Day. Ether Year. Wow. Ether Day. The event took place at Massachusetts General Hospital, where dentist William T.G. Morton and surgeon John Collins Warren successfully used diethyl ether to prevent pain during surgery. The importance of anesthesia cannot be overstated because before its discovery, surgeries were rare, perilous, and performed without pain relief, often resulting in unspeakable agony for patients. So just imagine, whatever your recent, even procedure, doesn't even have to be a full-blown surgery procedure without any anesthesia. Whew. Anyway, the rise of anesthesia transformed surgery from a last resort to a routine and critical component of healthcare. It has allowed for the development of complex surgical procedures that would be impossible without pain management, significantly reducing the risk and trauma associated with surgery. Anesthesia's evolution has been marked by the contributions of many individuals, including Horace Wells with nitrous oxide and Crawford Long with ether, among others. Their collective efforts have made surgical procedures safer and more humane, ultimately saving countless lives and improving the quality of medical care.
Yeah.
I mean, it just makes it easier. You imagine like you're trying to perform surgery on somebody that has no anesthesia.
Yep.
It goes both ways.
Very impossible.
Yeah.
Very much impossible.
It's crazy.
Yeah. And anesthesia has just really opened up a lot of doors to like what you had mentioned, like pain management and just a ton of other things that we use anesthesia for. Sorry, guys. Brownie is real needy today.
He's just laying his head on
I'm going to call you Chelsea.
Love is blind.
Love is blind.
Love is blind reference right there.
Yeah. Whoever knows, we need to have a watch party.
I know, seriously. That would be
So good.
awesome. Maybe Patreon.
I know.
Patreon.
All right. So another great medical discovery is epidemiology.
Yeah.
Okay. So epidemiology is the study of how disease spreads and how it can be controlled. So it started a while ago, but it wasn't called epidemiology until 1802 when a Spanish doctor named Joaquin de Villalba used the term. So before that, some civilizations like ancient Greeks and Romans had the ideas about disease and health, and that were early forms of epidemiology. They thought about things like clean water and how the environment affected health. As for its importance, epidemiology is incredibly important because it helps us understand and stop diseases by spreading. So it's a big part of public health, which means keeping lots of people healthy. Epidemiologists, the scientists who study this, looked at patterns and causes of diseases in groups of people. So they help figure out what makes people sick and how to prevent it. This work has led to better health for everyone, and it's helped control diseases that used to be really big problems. So this is major, and especially for the world of medicine. I mean,
Yeah.
part of our studying of diseases is looking at the epidemiology
Yeah.
of things.
Where did it come
Where
from?
did it come from? And that just gives us an idea of like
Of it
age, where you're
spreading.
from, like how did you, yeah, exactly. What are your risk factors? All those things. It's a huge part of medicine. So it's a huge discovery.
So germ theory. Germ theory. There we go. Wow. Before the germ theory came about, the widely believed theory was that disease was caused by spontaneous generation, in quotes, which God only knows what that meant
means. Yeah.
to them back then.
Doctors didn't know how to explain it. And they're like, oh, spontaneous generation.
It
That's
just,
it. It just came.
just came to you. I don't know. It's just like, eh.
Yeah.
Anyway, so in other words, physicians of the time thought the disease could appear out of thin air. Exactly. Rather than being airborne or transferred via skin to skin contact. In 1861, French microbiologist Louis Pasteur, okay, I can never say it right, proved through a simple experiment that infectious disease was a result of an invasion of specific microscopic organisms, also known as pathogens, into living hosts. This new understanding marked a significant turning point in how diseases were treated, controlled, and prevented, helping to prevent devastating epidemics that were responsible for thousands of deaths each year, such as the plague, dysentery, and typhoid fever. So yeah, pretty important.
Yep.
Because back then, again, it was like, oh, it's just luck. I don't know, it just happened to you.
Yeah.
You know?
All right. So another big discovery. I'm wondering, did you put penicillin in here?
Mm-hmm.
It is.
Antibiotics should be coming soon.
Oh, okay, cool. So, all right, another medical discovery is antiseptics. So, antiseptics are chemicals that stop germs from causing infections, so especially in wounds. So, the big moment for antiseptics came when a British surgeon named Joseph Lister used them in the 1860s. He got the idea from Louis Pasteur from his work on germs. So, Lister used a chemical called carbolic acid to clean wounds and surgical tools, which was a new idea back then. The discovery was super important because before Lister, surgeries were really, really risky due to infections. So people could die from infections even if the surgery went really well. And the reason why is because everything was dirty.
Yeah.
So
They would go from like surgery to surgery or anything without washing hands. It's mind blowing to think of now.
Without washing hands, without really like disinfecting tools correctly.
Yeah. Crazy.
So with antiseptics, surgeries became much safer because the germs that caused infections could be killed. This has saved so many lives and is a key part of modern medicine today.
You want to read this one because I know you wanted that one.
I know.
Read it.
All right, so antibiotics. So Alexander Fleming found the first antibiotic, penicillin, by accident in 1928 when he noticed a special mold that could kill bacteria. So this guy was just like growing stuff in his little petri dishes, and then he was like, "Oh,
He's like,
that's
"That's
interesting. That killed
different."
that, yeah." So then at first, people didn't realize how important this was. But in the 1940s, during World War II, American companies started making a lot of penicillin, and it was used to save many soldiers their lives.
Yeah.
So two other scientists, Howard Florey from Australia and Ernst Chain, who fled from Nazi Germany, helped make penicillin more available to everyone. So this discovery has saved millions of lives since then, but now some bacteria have learned to survive, or there's been some resistance, that's what we usually say, with antibiotics. So it's a huge problem, all right?
Yeah.
That's why sometimes when you say, oh no, the doctor didn't give me anything. It's not that we don't want to give you anything.
You
It's
don't
just
need it.
you probably don't need it.
Yeah.
And truly, we're trying to really decrease that risk of resistance. Okay.
Because if you have a viral infection, an antibiotic is not going to do anything.
Exactly.
It's a virus versus a bacterial infection.
Exactly.
But yeah.
So there's a rush to find new ways to fight these super strong bacterias. Julie and I actually just did an episode on CRISPR.
Yeah.
Was that on our Patreon or on our
That was
weekly?
on the weekly. So yeah.
So we just did an episode on CRISPR, on how they're using CRISPR to manipulate these certain type of genetically
Yeah, to the
altered
genetic
bacteria.
exactly in the genetic level to manipulate these bacteria to become again
More resistant to it.
well less resistant.
I mean, less resistant. Sorry.
Less resistant.
More susceptible.
Exactly. So then we could use antibiotics again, or just figure out a way of a better way of killing them because we're just getting more and more MRSAs.
Yeah. And now we even have a penicillin shortage. Isn't that crazy?
Oh Lord,
It's crazy.
And something that clearly has been around for that long.
Yeah.
Anyway, so antiviral drugs, which is what you would take instead of antibacterial.
Yep.
In most cases, that's the thing. Like most common colds.
Antibiotics, you mean?
Sorry, antibiotics. That's what I meant.
It's fine.
Anyway, because most people are like, oh, I have a cold or this not like I need antibiotics. It's like most of the time it's a viral infection. I just gotta write it out. Unfortunately, like the flu or what are you gonna do? Or you could take one of these if you really need it. If your doctor tells you, hey, take the Tamiflu or whatever it is. Many horrible viruses like smallpox, flu, and hepatitis have made lots of people sick for a long time.
HIV.
Yep, a lot of antivirals for them. Antibiotics became really good at fighting bacteria in the 1930s and 1940s, but medicines for viruses didn't get better until the 60s. This is because viruses are tricky and they have their own genetic material wrapped in a protein shell that hides and grows inside our own cells. It's hard to stop them without also hurting our own cells. So these medications, they go ahead and they target the viruses and they stop them from making lots of copies of themselves. And some even help our body's defense system fight the virus. So these medicines are really important for treating and stopping diseases like HIV and AIDS, Ebola, and rabies from spreading, which are all incredibly important. I mean, we've gotten to the point in HIV AIDS that it's a lot better these days than back in the 80s to live with HIV, you know?
I mean, now we have antivirals right now that you take before exposure.
Exactly.
So pre-exposure prophylaxis.
That's true, yeah.
And we have post-exposure prophylaxis, which is like crazy how if you do it, it's so effective.
Yeah. It's amazing.
And viruses are weird and they're very
Well, they mutate.
they
very
mutate
easily
and
fast.
they see something and then they like redo their DNA to like avoid that.
Yep.
So
Or their RNA, whatever. I mean, it depends on whatever.
it depends on the virus. It depends on the virus and how they do it. But
they're all different, and that's why we all have for the flu. That's why every year there's different vaccines for it because they constantly mutate. There's constantly different variants of it. And of course, don't even mention COVID. I mean, but anyway, go ahead.
All right, so insulin started being used to treat diabetes in 1922 after it was found by scientists in Toronto the year before. So before insulin, there wasn't really a good way to treat type 1 diabetes. So remember that we have different types of diabetes. We have type 1, we have type 2, we have a mixed, okay? But basically with usually type 1 diabetes starts when people are younger, okay? So without insulin, kids with type 1 diabetes used to live only about a year and a half after finding out that they had it. For adults, only 20% lived longer than 10 years after diagnosis, and they often had serious health problems because of the diabetes. Now, with insulin, people with type 1 diabetes can expect to live a full life. So type 1 diabetes is that you cannot produce insulin, okay? Type 2 diabetes is that you have insulin resistance. So your body makes insulin, but it's always at such a high level because of how much sugar you have in your body that you basically become like, it doesn't become as effective.
Okay.
So people with type 1 diabetes, you need insulin because you don't have it. Okay?
Right. You just don't produce it.
You don't produce it. Yeah.
Okay. So heart surgery. In 1967, Dr. Renee Favaloro, I'm going to go ahead and say it like that, did the first heart bypass surgery by using a vein from the patient's leg to fix a clogged heart artery. This new surgery helped blood flow better to the heart and reduced chest pain and heart attack risk. Over the past 25 years, doctors have made heart surgery safer and less invasive, which means that they don't have to open up the chest as much. They also started using robots in heart surgeries, which makes their surgeries quicker, more comfortable for patients, and helps them heal faster. People have also had heart bypass surgery and survived the first month can expect to live as long as anyone else. In the US, better treatments for heart problems have helped lower the number of people dying from heart attacks. So in 1999, 87 out of 100,000 people died from heart attacks. But by 2020, the number went down to 38 out of 100,000 people. This shows how important these improvements in heart medicine are.
Yep.
It's pretty drastic.
All right. This is another one that I thought about, but I didn't think that it was going to be like a major medical discovery, but I guess it makes sense.
Yeah, I mean, it's kind of like the foundation to
I
a
know
lot
it's
of
a
things,
foundation,
you know?
exactly.
Yeah.
So it's when they finally figured out the actual structure of DNA, which is a double helix. Okay.
Yeah.
So in 1953, two scientists named by James Watson and Francis Crick. Lord Jesus, I mean, talk about
I haven't heard that in a
these are
while.
Papa and Papa of biology. Okay. So two scientists named James Watson and Francis Crick figured out what DNA actually looked like. So they saw it as a twisted ladder or a spiral staircase called a double helix. The steps of this ladder are made of pairs of tiny things called nucleotides. There are 4 types, and then they always match up to the same way. All the nucleotides are A, T, G, C, so it's either A to T or G with C. So this matching is how our bodies know how to build and fix themselves. So basically, you have DNA, you have these nucleotides, and then depending on how they match and in the pattern that they match, that's what makes these proteins and then makes what our body functions as.
Yeah.
Very simplified version. Okay?
Yeah.
So the discovery was super important for medicine. It helped doctors understand diseases better and find new ways to treat them. It also led to new tools like genetic tests that can tell you about your health and where you come from. Plus, it's been really useful for solving crimes and learning about all kinds of living things. So finding out about DNA shape was a big deal because it's an instruction book for pretty much all of life.
Yeah.
And then it also led to advancements like gene therapies and personalized medicine.
Yeah, it's just a foundation on almost, if not everything,
Yeah.
medicine.
Exactly.
So, I mean, it's a big deal. So, blood storage. If somebody needs surgery or gets really hurt, getting a blood transfusion is an important part of getting better. This happened a lot in the war, all that. So back in 1964, scientists figured out how to keep blood safe for a long time and started the first blood bank in New York called Community Blood Center. Thanks to their work, people got better at giving blood and keeping it safe for when someone needs it later. And it's just I didn't even think about it until I started doing research on all these discoveries. And I'm like, yeah, that's right. We now have the comfort and the convenience of, we need blood. It's available in the hospital.
And now
But
it's not
back
just
then,
limited
it's
to
like,
blood. I mean, now it's platelets.
Oh, yeah. Now it's so much more than that.
Plasma.
But even just thought of having blood readily available, because that could save a life immediately, So, yeah.
All right. So immunotherapy is a groundbreaking approach to treating cancer that capitalizes on our body's own immune system. So our immune system, composed of white blood cells and lymphatic organs and tissues, it's natural defender against infections and diseases. However, cancer cells often manage to evade our immune system. Why? Because they're our own cells that kind of go rogue. Immunotherapy addresses this challenge by boosting the immune response and modifying the immune function. So it began with pioneering work from William B. Coley in the late 19th century. His experiments used mixed bacterial toxins that laid the groundwork for future research. However, it was his daughter, Helen Coley Knotts, who championed the cause. In 1953, she co-founded the Cancer Research Institute, dedicating to exploring immune-based cancer cures. Fast forward to today, and immunotherapy has become a game changer. In 2013, Science declared its scientific breakthrough of the year. Now, up to 1/3 of cancer patients are eligible for immunotherapy, offering hope, longer lives, and brighter futures for millions worldwide. Donate to cancer research, people.
Yep. It's a
very
big one.
Important.
It's a big one. So something that sounds like we definitely take this one for granted.
Yeah.
Oral rehydration therapy. So oral rehydration therapy, or ORT for short, is a super simple treatment that saves lives by stopping people from getting too dehydrated when they have diarrhea. It's just a drink made from a mix of water, sugar, and salt. This drink works really well because it helps our bodies soak up water better. The scientists from India, Edra Nath Chacheri, came up,
Silence.
yeah, Chatterjee,
Yeah.
maybe Chatterjee. Okay.
Maybe Chatterjee.
Yeah. Came up with the idea in 1953. But it wasn't until the 1960s, that doctors realized about adding a bit of sugar would make it even better. So since then, it's been used all over the world, especially in places where it's hard to get to the doctor. People say that oral rehydration therapy is one of the best medical discoveries ever because it doesn't cost much and it's saved millions of lives. It's really important for helping kids who get sick with diarrhea, which can be dangerous if they lose too much water. And even not diarrhea, but like just regular dehydration from heat, other illnesses, other fevers, so many things. You could get dehydrated from it, and that will accelerate the process of you passing, unfortunately.
Yep.
And this could stop it, and in a very like inexpensive way, you know.
Yep. All right. This goes out to all the ladies. Women's Health. In 1945, George Nicholas Papanicolaou created the Pap smear test. This test was the first of its kind to help find cervical cancer early. Thank you, Sir Papanicolaou.
Yep, let's light a candle.
Yeah, it was simple, didn't cost much, and helped lower the number of women getting cervical cancer. Today, doctors still use the Pap smear as a regular checkup to help keep women healthy.
Yep.
Crazy how just one small test
has saved
millions
of lives.
Billions.
Yep. Risks of smoking. Yes. Because before then we just had no idea. And then we recently discovered about it. But anyways, it's not even that recent. The risks of smoking were first hinted at in the early 1600s when an English author suggested that illnesses seen in chimney sweepers from soot might also come from tobacco. However, it wasn't until the 1940s and 50s that cigarettes were recognized as a cause of lung cancer epidemic. This discovery was made through a combination of epidemiology. Listen to our Patreon episode. Wait, no, actually.
It's this one.
Oh, it's this one. Never mind. Listen to the beginning of this episode. Sorry. Both episodes are kind of like in a blur tonight. Yeah. Anyway, so through a combination of epidemiology studies, animal experiments, cellular pathology, and chemical analytics. The importance of this discovery is immense. Smoking is one of the leading causes of preventable disease and deaths worldwide. Understanding the risks associated with smoking has led to public health campaigns, changes in laws, and general decrease in smoking rates over time. It has also spurred ongoing research into the effects of tobacco.
Tobacco.
Yeah. I don't know why I thought I said that like in Spanish. Anyway, and the development of treatments for tobacco-related diseases. The revelation of the dangers of smoking has saved countless of lives and continues to be a critical area of medical research. The year when the link between smoking and lung cancer began to be widely acknowledged was around the 1950s.
The 1950s had a lot of things going on.
A lot of things going on.
It was a major decade.
For medicine, yeah.
Yeah.
Pretty big.
So antipsychotics, other things in the 1950s.
Yeah,
okay. It was an area of medication used to treat serious mental illnesses such as schizophrenia, which was discovered in the 1950s. The first antipsychotic, chlorpromazine. I can never say it. I never could as a medical student. I can barely say it right now. But chlorpromazine was introduced in 1955 by French psychiatrists Pierre Dennecker and Jean Delay. I'm guessing that's how you say his name. Could be just Jean. Okay.
No, I'm pretty sure it's Jean.
Yeah. So this discovery was a major breakthrough in medicine. Before, antipsychotic treatments for mental illnesses were not very effective and often harsh, like, lobotomy. Check out our episodes.
Yeah, go back to that one.
Yeah. But the introduction of antipsychotics changed that and saved lives.
Yeah.
So these drugs have allowed countless individuals with severe mental illnesses to manage their symptoms better and lead more stable lives. They've been a cornerstone in psychiatric treatment for over 60 years and are considered one of the greatest advancements in treatments in mental disorders. The discovery of antipsychotics is also important because it led to a shift in how society views and treats mental illnesses. It helped move treatment away from large institutions and towards more community-based care, which is more personalized in general. So this has improved the quality of life for many people with mental health conditions. The year when antipsychotics were first introduced was in 1955. So another great discovery.
Yeah.
For the 1950s.
Huge for the mental health community, especially back in the 1950s.
Yeah.
I mean, again, go watch or listen to our lobotomy episode. It'll blow your mind with how they used to treat them. But anyway, organ transplants. In December 1954, doctors in Boston did the first kidney transplant that worked. Before this, no one had survived after getting a new organ. They figured out how to solve some tricky problems, like connecting blood vessels and putting the kidney in the right place without the body rejecting it. Later, doctors did the first lung transplant in 1963, and then they transplanted other organs like the pancreas, kidney, liver, and heart in the next few years. These surgeries have saved lots of lives, like thousands, maybe millions. Over time, doctors got even better at doing transplants. They did the first hand transplant. It's like one of the busiest parts of your body.
Yep.
They did the first hand transplant in 1998 and the first full face transplant in 2010. I remember seeing this in the news.
Me too. That would be a good...
Oh, yeah. We should probably cover that one. Insane. Like how we've been able to do all these transplants, you know?
I know.
It saves a lot of lives and just so, yeah, just mind-blowing.
Seriously. All right, so medical imaging. X-ray technology started by accident in 1895 when Wilhelm Conrad,
It sounds German. Röntgen? German.
All right, Wilhelm. Okay, Willem.
It's like their
Conrad.
Their version of William.
All right, Conrad. A German scientist found a new kind of light while working with a special tube. So this discovery helped doctors see inside the body, and the first X-ray department was set up in Glasgow Hospital the next year. Ultrasounds, which uses sound waves to make pictures inside of the body, began to be used by doctors in 1955. Another one for the 50s.
I'm telling you.
It was great for checking on babies before they were born and finding problems in their stomach area. 10 years later, in 1967, the CT scanners were made. They use X-rays and computers to make very detailed pictures of inside the body and are very important for finding many different diseases. And then in 1973, the MRI was invented by Paul Ludeber. It uses a special kind of magnet to get really clear pictures and slices of inside the body. So MRIs are super helpful for doctors to find things like tumors, cysts, and injuries to the brain, spinal cord, and other parts of the body. So the MRI, and it's more than that. The MRI can look at tissue so much more precisely. So, you know, it's not just for like the brain. I think a lot of people associate MRIs with the brain.
It's just tissues in general. It's not just like X-rays that are mostly for skeletal, like for your bones.
Yeah, it can look at bones. It can look at muscles. It can look at ligaments. It can really do a lot of detailed work.
Yeah, I thought that was like a huge medical discovery because we're able to like see inside the body without having to open it up for any problem. And that's huge. So next one, which is more recent, we're getting to the more recent discoveries now. So stem cell therapy. Stem cells are amazing because they can turn into any kind of cell in the body.
They are pluripotent. Do you remember that?
Yes. Yes. Anyway, you're going to see what we're talking about. So people found out how special they are in the late 1970s from blood in the umbilical cord. Did you ever see? No?
No.
I did. I still have it, but I mean, you know, it's one of those things. Anyway, these cells are great because they can make copies of themselves and stay ready to act even if they haven't been active for a while. They've been used to help people with blood diseases like leukemia and bone marrow transplants. Scientists are trying to use them to fix spinal cord injuries and brain diseases like Alzheimer's, Parkinson's, and damage from strokes. But using stem cells from embryos is a big ethical problem, and it's hard for scientists to use them to make these new treatments.
Yep.
But it's very, very interesting, you know.
Yeah. Gene therapy. So again, check out our CRISPR episode. So gene therapy. One of the latest big medical breakthroughs is gene therapy. It's a way to treat or stop diseases by changing the genes inside cells. So for the first time doctors tried gene therapy was in 1990, and it worked for a 4-year-old girl who had a rare sickness that made her very weak against infections. So now doctors in the UK's National Health Service is using gene therapy to help some people see better when they have certain kinds of blindness. So gene therapy could also help with lots of other diseases like heart problems, hemophilia, and cystic fibrosis. Scientists are also looking into how gene therapy might fight cancer. They're studying ways to make the body's defense system stronger and help cancer treatments work better and stop cancer cells from actually growing.
Yep. And then 3D printing. This is very recent, but we're just finding more and more uses for it. So the first 3D printer was made in the 1980s by a man named Chuck Hull. He made it to create solid objects for making things, like just ordinary things. Soon doctors and scientists started getting interested in it. Now 3D printers are used to make things like fake teeth and body parts. But scientists want to do more, like making whole organs for the body. There's a lot to learn, but scientists have begun to print tiny parts of the body like cells and tissues. They use a special method called 3D bioprinting. This helps them make new materials to learn more about how our bodies work. In the future, we might see organs made by 3D printers that can be used to test medicines and maybe even stop the use of animal testing.
Yep.
And lastly, I'm sure that you all have heard of this one because it's everywhere now for everything, but we're using it heavily. Bless you.
Sorry.
No. We're using it heavily in medicine, even in medical schools, as like check out our previous episodes on that. So AI has been getting better since the 2000s and has changed healthcare a lot. Companies that work on health and new tech like Google, IBM, and Apple are working together to make new tools to fight diseases and help patients. AI is used for many things in healthcare, like finding out what disease someone may have, making new medicines, planning treatments specialized for one person, watching over patients, making chatbots to talk like humans. Also, a lot of companies that work on health are using AI to make and work better, faster, and more efficient. So that is the latest on that. Bless you.
Should we make an episode on allergy shots?
On allergies, we definitely can. We definitely can.
My goodness.
But yeah, thank you guys for tuning in. And I hope you liked this one. This was another one of the requests that we had on Threads. Thank you guys so much for interacting with us on Threads. Bless you.
Guys, I'm having a moment.
She's having a sneeze attack.
Yeah, for those of you watching on YouTube, I'm not crying.
She's not. It's allergies.
These are my allergies.
She was totally fine in Orlando, but Miami, the swamp that we live in,
Look at my eyes. They're just bloodshot.
Yeah.
Anyways.
Thank you guys so much. Check out our Patreon because we are currently close to 30 some odd episodes in our Patreon. So you could catch up on all of those if you join us there.
Yes.
And keep commenting. We're on everything. Twitter, Instagram, Facebook, Threads. This one came from Threads. Everywhere. Comment. Let us know if there's something that you want us to talk about, if we missed something, if you want a full-length episode on something that we talked about today, or something else entirely. Thank you for everyone that has subscribed, and thank you, Patreons. You guys are the MVPs. And we'll catch you on the next one.
Be an MVP. Join our Patreon.
Yes. Join our Patreon. Help us maybe get a pod lab situation where you don't have allergies at.
Yeah, I know, for real. A little bubble.
Oh, yeah. That'd be great.
It's just this eye. Just this one. All right.
Bye, guys.
Bye.